Hey guys, welcome to my channel, Life with Brittany, where we talk about self-development, motivational things, and also nursing. So I wanted to do this video for all my nurses out there that have realized that you don't particularly like bedside nursing. So I wanted to share my experience of some other opportunities that I received throughout my career that was away from the bedside that allowed me to continue to practice and work as a nurse and have jobs that I actually enjoyed. And hopefully this advice and some of the stories I share can help someone that's in that, in starting to feel like they don't like nursing anymore. What can I do? What are my opportunities? But you don't know what else is available to you. Sometimes when we start our nursing career, and also when we're in nursing school, they can make you feel like the only thing you can do is work inpatient. And in nursing school, they might have persuaded you to do the typical med-surg nursing, work on the floor, get that clinical experience, and then you get there and you realize you don't particularly like it. So I believe in always going for what you want and not staying in a situation that you don't particularly like just because other people have told you that's what you should do. This is your life. You are in control. You are in control of your own destiny. So this is what I did when I realized I didn't like bedside nursing, to take control of my own situation. So when I initially started out my career, I did an entire year inpatient. It was in oncology, step down unit, and it was a very challenging time of my life. It was, I learned a lot. I made a lot of friends, but I knew that first week that I was not gonna like it and I was kind of stuck. So I was in a year-long contract that I could not break. If I did break it, then I would have to pay $13,000 back. I think it was about $13,000. And actually, I think the contract was 2 years long because I remember I could not leave Orlando. That's where I started my career, in Orlando. And I knew a couple months in, I was like, okay, well, I don't like this. What are my other options? And I remember going to HR, trying to find out what was really in the contract, and realized, oh my gosh, if I break this, I'm gonna owe $13,000. So, you know, sometimes when you're in a rush to get that first job and you're like, oh my gosh, I finally got an opportunity, let me just go with it and just take it. You know, you're not really reading all the fine print, which I know this sounds dumb, but you don't really look into all the details because you're just happy to have that opportunity to get your first job. So when I realized that I didn't like it, I had to come up with another strategic way to fulfill my contract without breaking it. So like I said, I did an entire year inpatient. And then after that, I started applying to other jobs within the hospital. So luckily, I came across a position that was outpatient. I originally worked with adults, but this position was going to be with the kids. It was going to be in peds, which I was excited about because I was finally going to get an opportunity to work with children in the hospital. There's another video that I'm going to post that actually talks about my first nursing experience that didn't go well, but I'll share that experience later and kind of give you the background of what happened with that position. But working with adults was the first job that I had that was a year long, gaining all that clinical experience. And so when my year came up, I decided to go outpatient. Outpatient was a very good experience as well. It was an infusion center. So this allowed me to basically take several patients at a time, give them an infusion, complete the infusion, and then discharge them. So it was totally different from inpatient, where you start your day, it's a 12-hour day, and you're gonna be with that same patient all day long. Versus inpatient, you'll have an opportunity to start somebody. You might finish in an hour, you might finish in 2 hours. It just depends on how long the infusion is. So I did that for about a year. And then after my 2 years of being in Orlando, I was kind of ready to move on to another opportunity. So I started to research and kind of looking at different cities, what would be a good fit for my personality, and also a place that would give me an opportunity to make more money, and also be in a place that I could see myself living. So after doing a lot of research, I looked into Houston, came to visit, And I was like, this is gonna be the move. I'm ready to go to Houston. So I started applying to jobs, and luckily I was able to get a position that was exactly like what I was already doing. It was a pediatric RN position that was in an outpatient infusion center, dealing with oncology patients and hematology patients, and I was gonna be doing the same thing. So it was a pretty good transition for me because I was able to take what I was doing and kind of translate that to the same role. So it was a good transition. After a while though of doing that, I realized again, okay, this is kind of sad. I'm kind of ready to get away from people who are, pretty much dying. It's a tough situation to be in, to work with those type of patients. I had the heart initially to do it, but after a while, it kind of started to weigh on me. So once I kind of got burnt out in that specialty, I decided that I wanted to work in the clinic. So I went to work in a clinic for a little bit, and it was all good in the beginning. And then guys, I got kind of bored. I mean, I went from always having to be on my feet, work fast, taking patients, discharging them, going to the next patient. So I was used to working in a fast-paced environment. Some people think that when you're working outpatient that you don't work hard and that it's the easy job, and you have your days where it's slow paced and you have your days when it's fast paced. So I was more so used to or accustomed to that fast paced type style. So working in a clinic and doing more case management, insurance type work, that's basically what it was more of. After a while, that became a little boring to me, but it was a good break away from the infusion environment and a good break away from the inpatient environment. So I did that, and then guys, I wanted to try something else. One thing about me is I am totally into beauty. I love fashion. I love helping other women feel great about themselves. And even with the friends that I have here in Houston, I'm always trying to give them tips and advice on how they can just better themselves in self-development and how to make themselves feel good. And I believe in investing in when you feel good on the outside, or when you look great, as I should say, when you look great on the outside, you feel good on the inside. And I decided that it would be great for me to try aesthetics. So I did that for a little bit. I did a little bit of the Botox injections and laser hair removal and facials, and just taking that time to pour into the med spa aesthetic nurse industry. And it was great, and I loved it. Those type of jobs, unfortunately, sometimes can't be too stable. Sometimes you have to give up having great insurance to be an aesthetic nurse, or having to work weekends all the time to be an aesthetic nurse. So it really depends on where you are in your life. If you have a family and children, maybe it won't be ideal for you to work every weekend. So for me, I personally don't have any children. I'm not married. So working weekends was okay. It just can be difficult trying to balance their social life when you're working every weekend. So that kind of got in the way of me having a life work balance. And with COVID coming, the job wasn't very stable. So right now I'm actually in a clinic environment. I work with teenagers, I work with babies, and I really love where I'm at right now. I've given myself the opportunity to have that chance to try different things in nursing. I've done the office, I've done the insurance, I've done inpatient, I've done outpatient. I've done it all, guys. And I'm glad I've given myself that chance to do it and not always focus and listen to what other people are saying, because if I did that, I would have never tried these other things. I would say my favorite position was probably aesthetic, and also what I'm doing right now, as I said. So just to kind of throw it out there and kind of get you thinking about maybe other things that you can try. If you have any questions for me specifically as far as like my aesthetic nurse position, how to get into one of those positions, because that's another thing. It can be a little challenging to get your first job as an aesthetic nurse. But like with anything, if you want something, you go for it. And if you keep trying to accomplish that one goal, eventually you will be able to get into it. So one day I might go back to aesthetics, but right now I'm just very comfortable with where I'm at. I have really great benefits. I love my pay. So I think I'm gonna stay here. So that's my experience I wanted to share of a couple of positions that I have in my 5 or 6 years of being a nurse. And if you guys have any questions, just comment below, like and subscribe to my channel, and I'll share a little bit more about my nursing experience with you guys. I hope you have a great day and you enjoyed this video. Bye.